My name is Dr. Tristan Hardy. I completed specialty training in obstetrics and gynecology and also a PhD in pre-implantation genetic testing. This means that I have a special interest in helping couples with genetic issues have a healthy pregnancy. The aim of reproductive carrier screening is to identify couples who have a chance of having a child with a genetic condition prior to them falling pregnant. A proportion of couples, maybe 1 in 40, have a chance of having a child with a genetic condition. Previously, it was difficult to test for more than one gene at a time, which meant that it was a difficult and costly process. Most couples only found out that they were carriers of a specific genetic condition after having an affected child, and most did not have any family history. Now we have the technology to screen for hundreds of genetic conditions before a couple tries for pregnancy. Recently, the Royal Australian and New Zealand College of Obstetricians and Gynecologists recommend that all couples have screening for these genetic conditions before they try for a pregnancy. This is because we are all thought to be carriers of multiple genetic conditions. Carriers are usually healthy and therefore do not know that they are at increased chance of passing on a condition to their child if their partner is also a carrier. Prior to having your test, you will have a genetic counselling session. The test examines your DNA, usually taken from a simple saliva sample. Once the results are available, usually within 4 to 5 weeks, you'll have a review appointment to discuss them. The Royal Australian and New Zealand College of Obstetricians and Gynecologists recommends screening for a handful of genetic conditions, including cystic fibrosis, spinal muscular atrophy, and Fragile X. However, technology allows us to screen for hundreds of conditions at the same time, known as expanded carrier screening. We will discuss this with you at your appointment at Repromed. This is a one-off test for couples. 97 to 98% of couples will find out that they're in the low-risk category. These couples will be reassured that they have a low chance of having a child with one of the screened for conditions. Of the 2 to 3% of couples who have a high-risk result, they will be provided with important information that allows them to make informed reproductive decisions. So what are the reproductive options available for couples? There are a number of options available and we will discuss them all with you at the appointment. Some people will choose to have genetic testing of embryos, others will try for a natural pregnancy with prenatal testing, and other options include access to donor sperm, eggs or embryos. It is important to note that you do not have to be having fertility treatment at Repromed to access genetic carrier screening. Any couple who is interested can call to make an appointment. Your first appointment will be with a genetic counsellor. Once your results are available within 4 to 5 weeks, they will contact you with the results. If further discussion is required, you can be referred to Repromed's team of clinical geneticists, IVF specialists and genetic counsellors to discuss your options.
Simply call us on 8333 8111 or visit repromed.com.au.